Hey everybody, I am here with Dr. Emil Shakov over at the Youth Fountain. You can find them at theyouthfountain.com. And so we're here to talk about their treatments for weight loss, along with some of the common causes of weight gain. And so, Dr. Shakov, thank you so much for joining us today. I really appreciate it.
Thank you for having me.
Yeah, absolutely. And I wanted to start off just by asking about, your experience working with these weight loss patients and really what got you, interested in working with them.
Sure. So I'm a general surgeon. My background is I did fellowship training in laparoscopic surgery as well as bariatric surgery. And I was doing high volume of bariatric surgery until 2013 when I finally went out on my own. Prior to that, I was an employed surgeon. So seeing bariatric surgery and the difficulty trying to get patients approved from their insurance companies for these procedures and the high risk nature of these elective procedures, although very beneficial because it does produce fairly good sustained weight loss, I knew patients were looking for something less invasive, not as difficult to do, and not having to change their internal anatomy. And when I went out on my own, that's when I got more training for non-surgical weight loss methods. And that's how I got started in this field.
Okay, definitely. And so your practice now mainly focuses on those less invasive treatments and different options as opposed to bariatrics?
That's correct. Yeah, bariatrics is very cost prohibitive. Even as a physician, the malpractice premiums are really just they're financial breakers for a practice. It's much easier to get patients on these non-surgical weight loss treatments rather than placing them through the rigors of getting approval and the surgery risks.
Yeah, definitely makes sense. And so what are some of the main treatments and things that you would focus on there, with patients that are looking to lose weight?
So we offer a wide variety of treatments and it's custom made for patients. So whatever their preference is for the treatments, that's where we try to focus our attention for them. So namely, the main treatments we do offer is number one, physician supervised weight loss, and that's with meal replacements. And these are physician grade meal replacements, not the kind of stuff like with Weight Watchers, but they are bars and shakes combinations and watching calories. Physician grade meal replacements are of higher quality than you would get just kind of over the counter, so to speak. So that's one option. You see a lot of patients aren't really interested in doing that, counting calories. So the one that's most popular are the appetite suppressants. So there is a wide variety of appetite suppressants, phentermine being the most common with the longest track record. So that's one of our main use of the medications is the phentermine. And also we do have alternatives to it depending on how long they've been on phentermine and their tolerance of that medication. Then we do offer some novel kind of weight loss with mix shots, which is a combination of 3 amino acids, methionine, inositol, and also B complex and L-carnitine. So these shots are not designed to make you lose weight, but they're an adjunct to a good weight loss program. Even if you're on your own, some kind of a diet, this injection will help mobilize more fat, give a little boost in the energy level. And then HCG diet, that's another one that's been around for decades. And even though the FDA does not approve the use of HCG for weight loss purposes, we've been offering this basically since I started the non-surgical weight loss portion of my practice. And we have really great results for patients to which we document using body scans to see where their weight loss is actually coming from. And the majority of patients lose their weight on this diet with fat weight loss as opposed to muscle weight loss with it, because it is a very low calorie diet. And these type of what we call crash diets, so to speak, where you go on a very low calories, typically you'll lose a lot of muscle before you start losing fat. So that's where we see the difference with using the HCG. And then finally, we've incorporated into our practice these newer class of medications called glucagon-like peptide 1 agonists, or GLP-1 agonists. And the most common one on the market that most know about is Wegovy or Ozempic, which is the diabetic version. But the main ingredient in it is a semaglutide. So that's a once weekly injection that helps patients have sustained weight loss.
Okay, and so would that be something that you would specifically use just for weight loss? Because I know, like you mentioned, one of them is more for diabetes and the other one's for weight loss. Do you ever use it for diabetes as well?
We don't do diabetic management in my practice, but the main difference between its diabetic version and its weight loss version is the dosage that you're at. The Ozempic version of it is at a lower dose, whereas the Wegovy is at a much higher dose, meaning once you've escalated the dosing for the weight loss purpose, you're going to be typically taking more per week in terms of milligrams as opposed to doing the Ozempic. But even as the weight loss version of that medication, it's designed to help balance out your blood glucose levels, or the sugar in your blood.
Mhm. And so would that be, how would you typically determine if somebody's a better fit for the phentermine or the semaglutide or the HCG?
So a lot of it does come down to budget, how much the patient has to spend, because each of these things cost different amounts of money, and also depending on how fast of a weight loss they're looking to do. If they're in a rush, then where they want to lose more weight in a shorter period of time, then HCG diet is the preferred one for them, because our female patients will lose between 10 and 20 pounds in a period of a month on that particular program. And our male patients can lose 20 to 30 pounds on the HCG diet. The phentermine is a very easy process for patients. The medication is not very expensive. Even when you buy them at commercial pharmacies, the generic is fairly cheap, where maybe they'll be spending $30 to $50 a month for a month's supply of that medication. So most patients can afford that cost. And it's an easy program to be part of. You take it in the morning and it suppresses your appetite essentially through the early evening. And whether or not you're on an active diet, which is always recommended, no matter what program we put patients on, we do give them a booklet to describe what it is in terms of weight loss, how many calories they need, and macronutrients, meaning how many grams of carbohydrates they should have in a day, protein, as well as fat. And I also encourage, as part of any of these weight loss programs, to do tracking of their calories through some of these free apps like MyFitnessPal. Once they start doing that for at least a month, I think they have a better understanding of what their daily caloric intake is, how many calories and macronutrients are in each of the different snacks that they might have, or the different meals that they might eat, which makes them more aware as far as how to better control their weight week to week, and also the importance of measuring your weight on a scale. That way, if you start going up on your weight, then you can cut back on calories. So phentermine is an easy one to do for that. And then finally, the GLP-1 or the semaglutide injectable medication. That one is a little bit more pricey for the patient's out-of-pocket costs. That one is not designed for rapid weight loss, but it is an excellent medication for sustained weight loss over a long period of time. It does have a lot of GI side effects we're seeing in our patients, namely nausea and vomiting can be pretty aggressive, especially at the first couple of days after the injection. If patients have an underlying constipation, then that will get worse on this type of medication. But most of these are manageable, these side effects. And patients that have known thyroid cancer conditions, or have what's called MEN syndrome, or multiple endocrine neoplasia syndromes. That could be something in their family or a personal history. It's not recommended for that class of medications because in animal studies, they saw an increased risk of medullary thyroid cancer.
Mm. And so with the semaglutide, you mentioned that that's a bit more of a sustainable plan for them. How long would they be able to continue taking that if they're, getting results from that?
Sure. So it's actually designed to stay on. There is no off time.
Yeah.
Now, the studies that I've looked at, when patients come off of it, they do regain their weight, not as rapid of a rebound weight gain as they would when they do crash diets and then they go back to their normal eating habits. But over time, without use of that medication, you will regain all of your weight back. So it's a safe medication. There are long-term studies out there to demonstrate its safety profile, but it is something that you would have to stay on indefinitely to maintain that weight loss.
And do you find that that's typically because of them, like you mentioned, going back to those, eating habits that they had before, or is that even with newer, better eating that they would still gain it back?
So if they were to maintain, their smart way of maintaining their weight loss, then you wouldn't need these medications to help you. But a lot of patients don't have that level of willpower, so to speak. So their hunger issue might, overpower their ability to skip on snacks or sweets or high calorie meals.
Mhm. Yeah, that makes sense. Yeah, and I could see it almost being beneficial if it takes a little bit longer and they really have to stay on it too, because at least that's more time that they can kind of continue those better eating habits versus, if you have 5 to 10 years of bad habits, it's tough to break that in just,
Right.
3 to 4 months.
Yeah. So one of my patients on the semaglutide, in a period of about 7 weeks, she's lost over 20 pounds. So that's life changing weight loss for a patient. It's like losing a small person, essentially from yourself. And one thing that is remarkable, and especially when I see it in when I was doing bariatric surgery, is the boost in self-esteem that the patients would have after the weight loss. You could just see like a whole different person, that they're happier, they just feel better about themselves, better body image.
Mhm.
So it's not just the weight loss for your own health reasons, which is important, but it's also for the psychological component and the benefits that it does for patients too.
Yeah, absolutely. Yeah, I think that the quality of life is definitely something it's overlooked. And I think when you gradually gain weight like that, you probably don't realize, how much of an impact that's actually having.
Right.
And so, do you usually recommend anything else alongside the program too? I know you mentioned that you guys have, the eating plan and everything for them. Do they typically need to exercise as well to get more out of it, or?
Sure. So diet and exercise will always get you more successful weight loss as opposed to just taking the medication. But the medications are designed for you to decrease your calories. So weight loss is basically, math. So calories in versus calories out. And the way the calories in is how we can control with the medications, but also with smart choices that you make with what you eat
Mhm.
as well. And also the frequency of your meals. So small meals will stimulate your metabolism. So that actually leads to burning more calories as opposed to having like 3 large meals in a day. And then when you increase your activity, that's calories out. So that the more active you are, and it doesn't even have to be that much activity. We're talking about doing a walk for 20 or 30 minutes.
Mhm.
That can be enough to help burn more calories, which would ultimately turn into more weight loss that you have. So when you do follow a good dietary regimen and you are active or exercising and you're taking the medications, you're going to have an overall a much better weight loss and more weight loss over a shorter period of time as opposed to just allowing the medication to do its thing. And even with these medications or any of these different types of diets, if you eat high calorie foods, you will not lose weight.
Mhm.
Drinking alcohol, people will take that for granted, not knowing that how many calories are in a beer or in a a cocktail, so to speak, and that's just extra calories for the patients. And if you drink like milkshakes, although it's not a large volume of food, it is high calorie, so you won't lose weight. So it's breaking those bad habits as well in order to have a better overall weight loss.
Yeah, that makes sense. And do you find that, with taking those medications that it's easier to avoid those bad foods in particular, or is it just generally reduced appetite?
Yeah, it's just generally reduced appetite. Those medications won't break the cravings.
Mm,
Although there are some medications that can help potentially break the cravings. So the HCG diet, that one of the um, effects we've seen with patients is they tell us they do have less cravings for those different types of foods there. So that's an added benefit when you can break out of that psychological impact of needing to eat. And the other thing, some patients will use food as an emotional stabilizer, so to speak. Somewhere down the road, they learn that food is good for when you're not feeling well,
mhm.
and then that's difficult to break from patients. But with the appetite suppressants, at least you'll be eating less overall volume of food because you'll fill up sooner. So even that will wind up helping you lose some more weight than if you didn't use it.
Yeah, definitely. And I thought that was great too. You brought up the MyFitnessPal too, because I think there's a lot of patients that probably have tried to eat healthier, but it can be confusing too if you go to the store and you see a bunch of things that say, that they're healthier, but if you actually look
Right.
in it, how many calories there are, it's really not.
Yeah, as part of our intake process, patients will list for what's their typical meals look like, what kind of snacks are they having, and I see a lot of times they put like very small meals, and you have to like scratch your head thinking you didn't get to overweight or obesity levels eating these small meals because they're not really aware of what they're actually eating in a day. But when you become accountable to yourself, and the only way to become accountable is actually putting down every single thing that you eat,
Mhm.
that you are tracking, and then at the end of each day, you can see how many calories that you consumed. Where they might be thinking they're consuming like 1,000 calories, it might be 2 to 3,000 calories, and just not being aware every one of these little snacks is
Mhm.
adding up. Everything that you put into a sandwich is increasing the calories that they might not be aware of. Those the different condiments that they might be placing on their meals, salad dressing. So the calorie tracking apps, whatever it is, MyFitnessPal is just the most common one. But any of that stuff really helps patients, I believe, have a more sustained weight loss and helps break that cycle of failure
Mhm.
with having a sustained weight loss.
Yeah, absolutely. And in your opinion, when should somebody really seek professional help and come see practice like yours?
Sure. So a lot of times patients will try yo-yo diets on their own with, they'll have this immediate kind of success where they lose weight. And then when they go back to their old habits, then they'll see how quickly the weight comes back. And it's even worse afterwards. And that comes down to a lot of these crash diets. Again, you lose lean body mass, muscle in particular. So when you lose that, your basal metabolic rate or your resting metabolic rate is going to decrease. And as that gets lower, you wind up burning less calories and then you wind up gaining more weight by eating less.
Mm,
So when patients have hit that kind of, even before that, but definitely once they've hit that frustration level where they've just given up and they don't feel that there's any way to help, that's when you should seek guidance from a physician or medical weight loss or even non-medical weight loss. There are a lot of good platforms out there that help you kind of break the cycle of the way you're eating, makes you have a better understanding of what you're eating in order to have less calories and a more healthier lifestyle. So some kind of professional help, almost for everybody, if you want to do weight loss the correct way instead of following the next trend or fad, diet that's out there, it's best to go to either a medical or a non-medical weight loss clinic.
Yeah, absolutely. And what would be the best way for patients to get in contact with you guys there?
Sure. So they can go on to our website. That's theyouthfountain.com. It's kind of like fountain of youth, but just a play on words. They can also come here. So we're located in Freehold, New Jersey, which is the central part of New Jersey. So the website and then our phone number is 732-333-5992. So they can call us direct as well. And then we do put different postings on Facebook. It's the Youth Fountain on Facebook and at Youth Fountain NJ for our Instagram handle.
Okay, awesome. Well, cool. Yeah, those are the questions that I had for you. Was there any last advice or anything you wanted to leave them with if they're thinking about these?
Yes. So in particular, you should never give up on your weight loss goals, no matter how frustrating things might go, where you just feel like you'll never be able to hit your weight loss goals. There is help out there, like in terms of like clinics like myself, physicians like myself that know the difficulties patients have. And also, I always try to explain to patients, I'm not here to belittle you or berate you or scold you if you fall off the diet some way. So I always tell them that, try not to shy away from just being honest to let me know what happened over that period of the last visit that made you gain the weight. Because for me, my goal is to help the patient lose the weight, even when they go through periods where they, quote unquote, fall off the wagon, so to speak. But yeah. When you do set your mind to a weight loss goal, you should definitely follow it and seek help if you can't achieve that for yourself.
Yeah, definitely. Yeah, I think taking that first step in that process and really just reaching out, getting help, getting that education is definitely, the biggest part and the biggest point to do.
Yep, 100% agree.
All right, cool. Well, awesome. Yeah, well, I love the work you guys are doing there. Thanks so much for taking the time to talk with us today and share the education. I really appreciate that.
All right. Well, thank you for having me.
Yeah, of course. All right, appreciate it.